Make it plain.
Make it plain.
MIP.
With Masamela Matfumo.
Mark Thompson.
Make it plain.
Get woke.
God bless you. Good morning. Get woke. Ladies and gentlemen, MIP is COVID free. Free meaning you don't need a subscription to hear MIP every day now for a limited time. While we endure this pandemic, we want to make it available to everyone. So wherever you get your podcasts, Apple Podcasts, Spotify, Google Podcasts, Stitcher, Pandora, MIP is COVID free and available to you and everyone without a subscription. Ladies and gentlemen, my guest is a researcher and an adjunct professor in the Howard University Department of Sociology and Criminology, where her research focuses on race, gentrification, health, and social policy. She is a PhD and MPH, a sociologist, policy analyst, and she is the principal of the Center for Urban and Racial Equality, a strategic research and consulting firm that partners with people and organizations to advance equity through policy, systems, institutional, and community change. We're happy to have on the show with us today, Dr. Judy Lubin. Dr. Lubin, welcome to Make It Plain. How are you doing and how is your family?
I am doing well, fortunately, and prayerfully. We are doing well, but adjusting and trying to get through day to day like everyone else is. But we're doing well. It's so good to be with you, Mark. Your voice is so important and so powerful in this moment, and I've been a fan of yours since when you were on WOL in DC.
Oh, okay. You're dating yourself now.
I
don't know if you want to do that. Well, bless you, and thank you so much for saying that. I read your most recent op-ed, and it confirmed a lot of things that are our greatest fears. The disproportionality when it comes to this corona is having a devastating impact on community of colors in general, but African Americans in particular.
Yeah, so, for several weeks, we didn't know quite what was going on, but I think there was a sense, right, in the community that coronavirus, COVID-19 was hitting us, particularly hard. I know for me, I was going on Facebook, and every time I would open it up, I would see faces of Black people, faces and stories of Black people. And so I think folks were feeling that something was going on, right? But we weren't getting the data. And so it was important that we saw members of Congress, that we saw there was a group of researchers, Black researchers in Virginia that put out the call initially, and then, civil rights organizations, started asking, where is the data? We need to understand what's happening with testing, what's happening with hospitalizations and death rates. And so if it wasn't for that outcry, we probably would still be in the dark right now in terms of really getting a sense of how COVID-19 is really hitting us, across the country, really in every major city.
And but still, we're not getting all of the racial data yet, are we?
We are not getting the data that we need. So last week, the CDC released data on Friday. 75% of the data on race was missing. Before the data that they did have, they were showing that 30% of all of COVID-19 cases across the country, Black folks represent 30% of those cases, and we're only 13, 14% of the population. So even with the limited data that we do have, we're seeing these huge disparities. And so that was just the CDC looking at the national level. And we're seeing, across in city after city, we're seeing similar disparities where we're overrepresented, sometimes twice the level of our population in these cities.
So now, who is responsible for collecting that data? Where does that really begin? At the local level, at the hospital level, or just what?
Mm-hmm. Yeah, so good question, right? So clearly the hospitals and the healthcare providers play a big part in this, but there's been a failure in leadership, right? There's been a failure in national leadership where the CDC could have made that call and made a strong call and requirement for hospitals and healthcare providers, local health departments to make sure that they're collecting that data. So at the local level, we know that that is happening, you know, at some level within the hospitals, and the health departments are collecting that information. And sometimes it's going through the state level health departments, and they're controlling that information. So we had some states that didn't want to release the race level, racial and ethnic disparity data. So right now, I spoke to someone in New Orleans, and you know, they were saying it's all over the place in terms of who's doing what. There's duplication, there's confusion. And so, you know, that just reflects to me the failure of leadership at the national level. When you see the CDC reporting, you know, 75% of the cases have no race and ethnicity data, when this is a basic principle of public health, you know, for the past 20, 30 years, because health disparities are not new. And we know that we need the data to be able to track, to know how we're going to target resources, which communities are being most impacted.
So, but I guess the other problem too is, and you allude to this in your article, we've been hearing stories about this, frightening anecdotes. If in order to compile that data, you have to also make decisions that you're treating African Americans. And so what we're hearing is some African Americans can't even get tested. So if we're disproportionately not being tested, then that lessens the number of cases in the system itself. And that's, to me, is even scarier.
Mm-hmm. Yeah, so again, domino effects in terms of just, you know, the rollout of the testing. We're still not testing at the level that, you know, we need to be testing. We're only 1 million people, I think, right now a week. And experts are saying we need to get to at least 3 million people tested each week to really get a sense of who's impacted. But, you know, the criteria, you know, for testing, you know, the past, at least they're starting to loosen it a bit, but I think a lot of us, we fell through the cracks with the initial testing criteria, where there was, you know, it was primarily because there just weren't enough tests, right? So it was primarily geared towards those who were 65 years or older, because, right, we know that our seniors are particularly vulnerable. And then requirement that you had symptoms, right? And now we know that lots of folks have COVID-19 and aren't displaying symptoms. And so folks weren't having access to the tests. People were, you know, having severe issues and still weren't being tested, right? Because they weren't in that age category or weren't sick enough, right? And so how sick, you know, do you need to be to get a test, right? And unfortunately, you know, we've seen too many cases. I started saving stories of people, of Black folks being turned away 2-3 times from the hospital. They couldn't get a test. They couldn't get admitted. So something, you know, is happening. And given the history of racial bias in this country, we have to pay attention, particularly when we have such wide-scale system failure. We know that we're going to experience the more deleterious impacts of government failure. And so I think we're seeing that now, where everything is basically broken down. Basic principles of public health, like data collection, the targeted outreach, you know, to our communities. It was, you know, there was data coming out in February and early March that those that have pre-existing conditions were at particular risk for severe cases of COVID-19. And so there was, you know, who has those pre-existing conditions disproportionately in this country? It's our communities. And so where was that effort to communicate and to get the wheels of public health and the principles of community health going, so that, you know, hopefully we might have been able to, you know, mitigate and prevent some of the loss of life that we're seeing.
Yeah. Clearly there was no interest in getting that done. And that's the original sin on the testing. You know, if everybody needs to be tested and tested in a broad range. But now let's go to the far end of this now, as your article indicates. and talks about. When African Americans are being seen by physicians or hospitals, we're hearing cases about who's being triaged, who's getting access to ventilators, and whether it's because of the color of our skin or the comorbidities and pre-existing conditions that African Americans disproportionately have, it's really both. You almost can't have one without the other. That's having an effect too, isn't it?
Mm-hmm. Yeah, it's clearly having, it's clearly having an effect where first you're having an issue with us even getting into the system, right? In terms of being able to access testing, being able to access care, which means we know that the longer you delay care, particularly when you're sick, that means you're going to get to a more advanced
Right.
Stage of illness. And so we're coming in with those comorbidities. It sounds like from what we know with advanced or severe cases of COVID-19. So by the time you're checked into the hospital, if you get checked in, right, that, you're in pretty bad shape. And so we see those breakdowns happening. And then, there's been a discussion about, because there was the ventilators, right? Like that, the shortage of the ventilators, and how do you decide, right? Like, when you get to a point where you're deciding who gets a ventilator based on their chances of survival. And for a lot of what they call crisis standards of care, right? In disaster moments like this, when you know that there's probably going to be a shortage of medical resources, who do you decide actually gets those life-saving interventions? And it's hard for us to think about that, right? Like that folks are going to be sitting there deciding, making these choices, and it's the side of healthcare when we're in a emergency situation like this, that those types of decisions sometimes have to be made. And a lot of these standards of care, say that those that have multiple conditions that reduces their chances of survival are in on that list for potentially not receiving ventilators. And I heard from a colleague that was asking, did we know of any resources that had an equity lens to crisis standards of care? Because if you're simply just going off of, or you're basing a good part of your decision on whether someone has chronic conditions or comorbidities, then we know that that's going to disadvantage Black folks and disadvantage other communities of color that have higher rates of hypertension, of diabetes, of asthma, and those other conditions that are really interacting with COVID-19 to make it particularly deadly. So there's been important conversation that's been happening over the past few weeks. We also heard, there were a couple of states that released some standards of care that, also implicated potentially not providing, ventilators to people with disabilities. And so, there's a host of issues that, are of concern. And we clearly see there isn't a focus on equity, particularly on racial equity, and making sure that Black communities and other communities of color that are already coming into this pandemic at a disadvantage will not be further disadvantaged by poor decision making and lack of leadership.
What can be done, Dr. Lubin, to enforce the collection of racial data? That's something you're saying the CDC really has to mandate, doesn't it?
They have to mandate it, and I think there's a bill in Congress now where there's an effort to mandate it, but the CDC can do it to make it really clear that as the data is coming in at the local level, you cannot skip the box or the line around, what is the race of the patient. And so they need to be clear. There needs to be just clear direction that this is important and critical for us to know.
Yeah. Well, if people are experiencing what they seem to feel may be some neglect or disparity, what do you suggest they do?
Mm-hmm. Yeah, so I would, a couple of things that people can do. I would reach out to your local health department, particularly if there is a health equity officer or community health coordinator, to 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 share what you're experiencing. They're also within healthcare organizations themselves, within a clinic. Reach out to the head person, the executive director, or within hospitals, they have ombudsmen that are responsible for getting down to the bottom of these types of issues. But the important thing is that don't take no for an answer.
Mm-hmm.
That it's about these are life and death issues. Is that even if you feel that you can't get tested, is to keep going, find another location. Same thing here with family. That was a family member that was sick and didn't think that they could get tested, and so we sprung into action and reach out to support, right, to folks who may be in the know. And that's what I think is really important in this moment as well, where sometimes we don't reach out to people, to our family, to friends. Reach out. If you're feeling sick, if you don't know where to go, call someone, text, let people know what's going on with you so that you're not going through this alone.
Yeah. Of course, Donald Trump hates the World Health Organization, but I was on their website and saw I knew it existed, but I saw for the first time the page devoted to what are known as health determinants. And, when I went through that, everything, I know it applies to a lot of people all over the world, but everything on that page applied to African Americans, the socioeconomic conditions that affect our health. So we can say, can't we, our struggle with health disparities has been generational. And so before Corona even came into existence, we were almost set up or put in a position to be at a disadvantage.
Yeah, so this is systemic and generational, right? As you said, right? If you go back to the history of Black health in this country, right? That, we have, from slavery through Reconstruction, through Jim Crow, post-civil rights movement, and now, right? Like, we have always had and received limited access to healthcare. We've received the poorest quality healthcare and have had the worst health outcomes, right? And so this is a systemic issue. This is not new, right? That there's been a movement for health equity and health justice for decades now. Trying to sound the alarm, Black folks trying to sound the alarm, public health folks trying to sound the alarm that we have these multiple social determinants that are producing poor health, right? That it's not at an individual level, right? That there's nothing inherently wrong with Black people, right? That race is not something that is biologically determined, right? That it is because of these social, political, economic determinants, right? That disadvantage us, that chip away at our health, that we don't, we have in our communities gentrification, affordable housing crisis, homelessness. 40% of all of those who are homeless are Black people. The issues, the crisis around labor policy in this country. We don't have paid sick leave.
Right.
And so we see all of these things coming together. We don't have living wage in most of the places where we live. So we see all these dynamics coming together, right, in a way that, creates this, perfect storm of inequity that, is able to capitalize, if you will, on those that are most vulnerable in our society.
And so this should strengthen the argument for healthcare reform more than ever, shouldn't it?
Mm-hmm. It should, right? If this pandemic doesn't make it clear that we need a real national health insurance program like Medicare for All, I don't know what else it takes, right? We cannot have a system where your ability to access healthcare is tied to your job. What happens when you have massive unemployment like what we're facing right now? How are you going to access healthcare? What happens when you leave the decision to expand a program like Medicaid to local or to state politics, right? people get left out, particularly Black people, especially in southern states where we predominate. Like most of the Black population in the U.S. lives in southern states. 60% of us live in southern states. And so this pandemic, right, we have to, if anything, right, we have to be clear about the need for Medicare for all. We have to be clear that we cannot tie access to healthcare to your ability to pay or whether you have a job. And so I hope, that, we come out of this, fighting
Yeah.
and ready to go on this issue, right? That we have got to transform the healthcare system in this country.
No doubt about it. And speaking of southern states, you're in one. It is in some of these states where these Republican governors want to prematurely reopen these communities. And you're in Florida. I'm part of a national prayer call every morning. So I'll be sure to include you in that since you're in Florida.
Please do.
Especially in Florida.
We need prayer.
Yeah. But, it's interesting because even some of the places they would argue for reopening, Dr. Lubin, are also places that we oftentimes as African Americans disproportionately patronize, right? So that will put us in even greater danger if these places are open prematurely, won't it?
Yeah, and then not only patronize, but often we're the service providers.
Right.
And so, and that's a big part of, the conversation that we're having in that, we are at risk because we are on the front lines, in these service industries. And so you're seeing that these governors are making these decisions that are not informed by public health. They don't seem to care that, that this rush to open up the country, right, is actually potentially a rush to open up to kill more folks and potentially kill more Black folks, right? And so the politics that, that is governing southern states and nationally, right, coming from the Trump administration is problematic. We see that people are not at the center of this pandemic, right? Even in a public health emergency, when you have to put people at the center, right, that is not what is guiding and leading the decisions that are being made.
You almost have to wonder in the political calculus, because in these southern states, in yours, for example, Florida, you open stuff up to it. We know white folks are dying too. We know that. Mm-hmm. And many of these whites who are older are in Donald Trump's and Fox News Channel's constituency. So you have to wonder whether the decision has been made that some of their lives are worth sacrificing as long as you get as many, if not more, Black lives as well.
Mm-hmm. Yeah. So, was it the lieutenant governor was one of those first Republicans a few weeks ago that said, we're just going to have to sacrifice, right? That,
right.
You have to open up, and if we lose grandma, that's okay, pretty much, right? That, so there's the calculus, right? That yes, we'll potentially, making this decision to open up will potentially get some of our constituents, but now, right now, it's looking like this is hitting Black folks more and Latinx folks. More that, and then in the cities, right? So it plays into this politics, right? It's the folks in the cities, it's the people of color, it's the Black, Latinx, and immigrant folks, right? And so there's a calculus being made that it's not necessarily going to hit the white conservative constituency as much, and that let this become a problem that Black people have to deal with, right? We can isolate, right? So we're seeing it play out. We're going to isolate this and move on, right? There's this rush to move on, and what happens when the country moves on and we're left, in Black communities all across the country, in St. Louis, in DC, in Baltimore, Chicago, New Orleans, without the resources, because the country has moved on, the government has moved on, and now we're left to try to pick up the pieces and try to have a recovery that doesn't have the adequate resources and support and coordination that's needed.
Yeah. You also, your Center for Urban and Racial Equality has a hub for equity and justice in the U.S. coronavirus response, correct?
Yeah, so we put this hub together, in about a month ago, we started, getting all of this information from different groups, that were responding, right? That's the one of the bright lights in this pandemic was that we were seeing, groups in our community really, springing to action, the mutual aid networks, the advocacy that was coming out really clearly about the things that we needed, paid sick leave, the moratoriums on utility shutoffs. And so lots of good resources targeted to Black communities, to immigrant communities, that was really trying to bring a equity lens and a racial equity lens to the response. And so we wanted to have a centralized place for people to be able to access these resources. So we have this just broad collection of information that's being put out by Data for Black Lives, NAACP, a number of different grassroots Black-led organizations, health departments. So it's a place to go, for folks that are also wanting to figure out how they can get involved, because there's a section on there that's targeted towards policy change and policy demands, particularly for us to understand like what we need to be asking for at the local level, because, federal government advocacy and policy is critical, in terms of paid sick leave and national health insurance, Medicare for all. But a lot of what we're going to need in terms of supports is at the local level. And so we need to get involved and be pushing our council folks, pushing local governments to respond in an equitable way.
Yeah. And folks, these are things that we've talked about on the show, things that we can do while we're home, and get involved and do organizing and be made aware, because this is going to be a marathon, not a sprint. We're not out of the woods yet. This won't be the last pandemic. And this one may not be over in the foreseeable future. They're even saying if once it flattens, it might come back. So,
right.
What are we going to do? I notice you also have a section up here devoted to the incarcerated community, the LGBTQ community, so many different communities that are impacted. Dr. Lubin, we also want to let our listeners know that you are at the Urban and Racial Equality.org Center, are doing a webinar, correct?
We have a webinar coming up on Thursday, May 7th at 6 p.m. And this conversation is going to be focusing on, one, we're going to get on the ground reports from Black public health professionals in Detroit, New Orleans. We're also going to have some policy discussion and the organizing that needs to be happening. So we'll have someone from New Florida Majority, as well as Brookings Institution that's been really doing some great analysis. Dr. Andre Perry that's been doing some great analysis on what's been happening in our city so that we can better understand what's happening. But then also as we're thinking about the organizing work that needs to happen to start to have that conversation, but we really want to hear also from our folks that are on the ground, triaging and responding to this epidemic so that we can really understand first where the gaps are, and then what are the solutions and the strategies that we need to start thinking about as we think about how we have an equitable response and recovery, particularly for Black America.
Urban and Racial Equity.org, folks. Go there to find out more about those webinars and get involved. Dr. Lubin, we appreciate you. Thank you for your work and your dedication to this. Lord knows we need you. And I will continue to keep you and your family and the center in my prayers, okay?
Thank you so much, Mark. So good to be with you.
All right. Likewise. You all take care now, okay?
You too. Take care. Be
all right.
safe.
All right. Bye-bye.
Bye-bye.
Thank you for listening to Make It Plain and Get Woke. Remember to listen, like, and subscribe on Apple Podcasts, Spotify, and wherever you get your podcasts. If all minds are clear, it has been made plain.